I grew up in Wisconsin, went to college at Princeton University where I studied philosophy and public policy, did my medical school at Washington University in St. Louis, where I also stayed and did my otolaryngology residency. And once I completed my residency, I came to the Medical University of South Carolina to do my fellowship in head and neck oncologic and reconstructive surgery. I chose to start my career as a head and neck cancer surgeon at MUSC because they provide some of the finest and high quality cancer care in the country, both in terms of the complexity of the surgeries that happen here and the outcomes that they achieve for patients. There was really no place I'd rather be to start my career as a head and neck cancer surgeon than here. One of the most important things about providing high-quality head and neck cancer care and something that's integral to my personal practice and part of my treatment philosophy is delivering patient-centered head and neck cancer care. So head and neck cancer, because it arises in cosmetically and functionally critical areas such as the face, tongue, voice box, jawbone, the cancer and its treatment often produce life-altering changes related to disfigurement, difficulty swallowing, difficulty chewing, challenges speaking, and it forces patients and providers to make really challenging decisions about how to pursue the right treatment. So as part of delivering patient-centered care, I spend a lot of time really getting to understand my patients, talking to their families, find out what matters to them, what they value, what their priorities are. And this information allows me to put the patients really at the center of the treatment planning paradigm. I think this is a key part to not only delivering care that helps cure patients of their cancer, but also to restore them in terms of form and function so that they can return to their normal life, eating, swallowing, going out in public, walking around the grocery store, not being self-conscious, and then come back to clinic years after they've cured their cancer, smiling and enjoying an excellent quality of life. My clinical areas of interest and expertise include both head and neck cancer ablative surgery, so this is removing cancers from the face, the mouth, tongue, jawbone, voice box, saliva glands, and then the lymph nodes of the head and neck where these cancers spread to, as well as reconstructing the defects that are left after the cancer removal surgery. Most commonly, this reconstruction involves microvascular free tissue transfer, which is a specialized kind of surgery in which we transplant skin, muscle, bone from faraway places like the leg, the back, or the arm up into the head and neck. During these sorts of surgeries, we take and shape the tissue into new jawbones, tongues, parts of the throat or voice box to help rehabilitate patients so that they can return to looking the way they used to look, swallowing, speaking, chewing, and enjoying the things that are critically important to having an excellent quality of life after a cancer cure. One of the most critically important parts of head and neck cancer care and something that is an area of special expertise at MUSC is delivering collaborative multidisciplinary head and neck cancer care. What that means is the head and neck cancer surgeons work closely with the radiation oncologists and medical oncologists to deliver radiation and chemotherapy when necessary, with the speech-language pathologists to help rehabilitate patients in terms of swallowing and speaking, with the oral and dental health professionals to help manage some of the long-term side effects and treatment toxicity in the mouth, and the psychologists to help with areas related to depression, anxiety, and distress that often accompany head and neck cancer and its treatment. This collaborative multidisciplinary environment, it starts before patients even set foot in the door and involves getting patients in to see us in a timely fashion, collaborating to get complicated medical records from many different places sent over, getting patients through their many consultations in a timely fashion so they can begin treatment, and then following patients after they've completed treatment to help check and make sure cancer doesn't come back, that no new cancers develop, and that patients are being rehabilitated in terms of swallowing, speaking, looking the way they want to look, and dealing with concerns related to anxiety and depression. In such a way, they go back to returning to their life, getting back to their job, going out in public, and enjoying a high-quality life.